special guest, Dr. Inna Husain, who is a board certified otolaryngologist with further subspecialization in laryngology. All things voice, airway, swallow. She is an expert and she is super passionate about laryngopharyngeal reflux. So we're so lucky to have her. She's globally known and has been published in over 30 peer reviewed articles. So thanks for being here today, Anna.
Yeah, thank you for that wonderful introduction. Happy to be here.
If you're new to me and my page as well, my name is Molly and Molly Pelletier, and I'm a registered dietitian specializing in acid reflux, GERD, and LPR. And today we're going to be talking about reflux in pregnancy, understanding reflux in pregnancy, how to prevent symptoms. So I'm excited to dive in.
Yeah, no, I am too. I think it's such a great topic because if you say the words pregnancy and reflux, I think everyone will be like, yeah, of course. That's like
Mhm.
so common. But then when you actually try to take a deep dive and say, well, what have you heard about it? What have you been told how to prevent it? And you'll find that that part of the conversation is often missing.
Yeah, for sure. And kind of why it even happens. I'll have clients that come to me with reflux and they're like, why do I have such bad reflux? And so maybe we can talk a little bit about the physiology and why is it so common with pregnancy?
Yeah, no, for sure. So I think we all understand that pregnancy is a very complex change that happens to a woman's body. And there's a couple of different things that happen that are natural, but they do contribute to increased risk of reflux. One of them is obviously hormonal shifts, and we're specifically talking about changes in progesterone and estrogen. So, progesterone is a very interesting hormone because it has a lot of effects on the GI system. It can relax muscles. And so when we think about muscles of the GI system, we often think about the lower esophageal sphincter, which is the muscle or the sphincter that connects the esophagus to the stomach. And so when that tone relaxes, it's a lot easier for things to move upward out of the stomach into the esophagus, which is what we call reflux. Now, progesterone also slows down gut motility, so downward effects, and that's what can lead to things like constipation during pregnancy. But decreased clearance, decreased motility downwards will also lead to more kind of slowing of digestion in the stomach, which again, if the stomach is more full, you're more likely to reflux upwards. So
Mhm.
progesterone is like a really big player in pregnancy. Now, as the pregnancy continues on and you start getting into second and third trimester, the baby's growth, the uterus can start pushing on the digestive system and on the stomach, contributing to more mechanical reflux. So you end up getting a combination of two different things that are happening, both which can contribute to reflux.
Yeah, really good point about the pressure. Additionally, from constipation, that's something I see a lot contributing to reflux.
Mhm.
So, when a patient comes to you struggling with these issues, what are some of the strategies you might use medically to manage?
So I'll tell you, a lot of times strategies are exactly the same whether you are pregnant or not. And so let's not, put pregnant women in a completely separate category. Let's go back to our basics and our understandings of what reflux is. And so a lot of the diet precautions, which I always defer, for more detail to my registered dietitian colleagues such as yourself to really fine tune and go into detail with patients about that. But I do big picture overviews, right? So we talk about actual volume of the meal, so definitely wanting to focus on smaller meals so you're not distending the stomach as much.
Mhm.
Be mindful of those things that relax that lower esophageal sphincter. So we're talking about things like caffeine. We're talking about reducing things like carbonated bubbles. Those bubbles love to move upward in reflux. And then general things like the amount of kind of acidity in the food and drinks that you're ingesting. So that's like a big kind of diet overview. And then, of course, things like how close you're eating to bedtime. So for all of us, we really shouldn't be eating, dinner right before we lay down because that's going to contribute to the mechanical reflux.
Mhm. Yeah, absolutely. Yeah, and I love that you brought up the nutritional side of things from a nutrition perspective. In addition to noticing the triggers, monitoring those, and small frequent meals. Also, oh, can you hear me? I think
I
I may have
can.
lost Wi-Fi. Okay, cool. I just switched to data. So, in addition to the food choices, we're also really thinking about the mealtime hygiene
Mm,
piece. I found this really helpful for my clients who are pregnant or not with reflux, because there's that extra pressure. on the esophagus, potentially from the baby, we do want to try to have good posture when we're eating, and this can really help. Having good posture after meals, during your meal can help. Chewing well, slowing down, that's going to help as well, kind of get the fullness cue to your brain. And when you are in that first trimester, there's really not an increase in caloric needs, but as
Mhm.
someone continues on in pregnancy, making sure you're getting enough nutrition is important. And when you're dealing with reflux, that can be challenging. So small frequent meals, making sure that those are high protein, potentially higher calorie if you're having trouble with the volume of food. So high nutrient density foods like pumpkin seeds, almond butter, yogurt, high protein foods like salmon, chicken, things like that can be really really important to focus on. And then the acidity point is a great point. So things that may have worked for someone before pregnancy, like kiwis or oranges, might not feel as good if someone's struggling with reflux. So papaya, honeydew, cantaloupe, watermelon might be more comfortable for people with reflux.
I think that's a great point you make about maybe before pregnancy, not necessarily having a sensitivity. And remember, that's
Mhm.
kind of the essential crux of what silent reflux is, right? That this movement can be happening, phlegm, throat clearing, and that can correlate with the sensitivity to the acid as well. And so that might be signs that reflux is actually happening, but you didn't think of it. And now you're sensitive to things like orange juice and acid in food and drinks.
That's a really good point about signs that it's happening, because people experience reflux different ways. Like you said, the silent reflux symptoms, people may have just thought reflux was just heartburn, but those other symptoms of, throat clearing, postnasal
Mhm.
drip, throat burning, feeling like something is stuck in your throat, voice changes, those are some signs that reflux could be happening. Yeah.
Definitely. Yeah.
Hmm. Yeah. Go
And
ahead.
that's why it can then that's why it adds to even the complexity of treating acid reflux, right, or reflux in pregnancy, because you might be having silent symptoms, and we know things like acid suppression doesn't stop mechanical reflux, and so that's one of the challenges with reflux in pregnancy. Obviously, this is not direct medical advice, and everyone should talk to their own healthcare team. But generally, reflux is treated with the use of things like antacids, which are generally considered safe in pregnancy, primarily the proton pump inhibitors and H2 blockers. The one caveat to that is most medication is not studied in pregnant women, right? And so there's always that concern that, like, what if, right? What if there is some effect? And we know acid suppression does affect your digestion and ability to absorb things like calcium, magnesium, and B12, which obviously has a lot of impact on a growing baby as well. And so I personally always like trying natural things first with my pregnant patients. Adding on supplements like alginates, right, can be really, really helpful. One of the ones I recommend a lot is called Reflux Raft. It is essentially something you can take after a meal, doesn't get absorbed into your bloodstream, and it can be excreted out. And so it can definitely be an aid while you're doing all the lifestyle precautions and diet precautions that we've been talking about.
Yeah, absolutely. Reflux draft is definitely something that I love using with my clients who are have reflux, pregnant or not. And I think there is a lot of concern about how those proton pumps might
Mhm.
impact someone who is pregnant. And so I use this pillow to explain that the alginate is creating a gel raft that is acting locally to create to help prevent the mechanical reflux from moving upwards, which is especially important with those LPR type. Might not feel a sense of burning, but the stomach contents moving up can still be really damaging, even if you don't have heartburn. So I think that's a great tool to use, especially at night. I think with my clients who are pregnant, the night tends to be a really problematic time. So we're talking a lot about, spreading your nutrition out throughout the day. So dinner isn't super super large, and then using an alginate afterwards, maybe again before bed. And yeah, I think that's just a really great habit to get into, because I know a lot of my clients who are pregnant are worried about, like, what is this doing to my body having
Mhm.
reflux during pregnancy? They're worried about, like, the
Right.
long-term consequences. So having a tool like reflux raft, alginate therapy is really key.
Right. No, I agree with you. I think it's interesting if we go back to what we started the conversation with was the mechanism of action. Both the hormonal changes and the growing baby are both mechanical triggers, right?
Mhm.
Mechanical reflux. And that's exactly what alginates help address is that mechanical reflux. And that's exactly what acid suppression does not address, right? So
Mhm.
when you get burning, sure, some acid can come up, but the root cause is the mechanical reflux. And so that's why I think, we talk a lot about alginate as a natural way. And pregnant women are definitely, a patient population that I kind of stress the importance of doing a little bit more natural with.
Mhm.
Personal story I'll tell you is I'm a mom of three, and my oldest is 10. So about 11 years ago, I was pregnant with her. And I remember getting reflux. And at that time, proton pump inhibitors were not recommended. So my OB GYN actually said not to take proton pump inhibitors. And then when I had my second daughters 2 years later, they were okay. So, I think it makes everybody a little bit nervous when there's kind of changes in guidelines and, depending on who is giving kind of the medical advice. So I think most people would want to try as natural as possible as a first step.
Yeah. Yeah, as a first step, I think going towards nutrition and lifestyle and trying to support yourself in
Mhm.
reflux prevention, but also, like you mentioned, overall digestion. Like, definitely preventing constipation is key too. And so we're thinking, trying to stay hydrated outside of mealtime. Sometimes drinking a lot of water during your meal can be too more pressure in your stomach, but trying to stay hydrated. Magnesium rich foods like dark leafy greens, soluble fiber and melons, things like that. I would really recommend. But yeah, I think try to utilize those strategies before kind of leaning on the medications is always a great idea.
That's perfect. And
Yeah.
I often talk when I see non-pregnant women who have got silent reflux. I always ask about that too. Did you have a lot of reflux in pregnancy, right? Because perhaps there was acid reflux there, but once some of the pressure and stuff changes, it can turn into silent reflux also.
Yeah. Yeah. I see that a lot with my clients' symptoms changing. Yeah.
Yeah.
This was super helpful. Thank you
Yeah.
so much. And,
Yeah,
and
of
definitely helpful
course.
to hear about your experience as well. Anything else you'd like to add before we close out?
Yeah, I think the one thing I would just like to add is that, if you're pregnant and you're dealing with these symptoms, don't feel like you can't ask for help, right? I think there's a certain kind of feeling out there that sometimes, you just have to deal with it because it's part of being
Hmm.
pregnant. And I just don't think that's true. I think there's lots of things and there's nothing wrong with saying, I don't feel great and I'm looking for some help. So I just let's like my like final thing is like don't give up. There's things that you can do. Being pregnant is a beautiful thing. We want you to try to get through it and try to help you along the way.
Absolutely. Absolutely. Thank you so much. I
Yeah, of
really
course.
appreciate
Thanks,
your time.
Molly.
I think this was super helpful, and I will put more info about INA down below in the description as well as Reflux Raft. And thank you guys for
Great.
joining us
Thank
today.
you. Thanks, Molly. Bye.
Take care.